So, a very important question, what are the different grades of placenta previa? You have two things, abruptio placentae, placenta previa. You must know what are the different grades. You have a total placenta previa as what you are able to see over here. When the placenta is completely covering the internal os, it's called total placenta previa with abnormal implantation. And there is a partial placenta previa when the placenta usually covers the internal os but not completely, it is only partially. And you have a low implantation of the placenta previa occurs whenever the placenta is attached to the opening or to the border of the cervical os but not covering it, then it is called as the low implantation of the placenta previa. Then if you take the abruptio placentae, that is the concealed hemorrhage, you have different types. You have a marginal or low type of abruptio placentae and a moderate high type and a severe and a complete type are the three different types. The amount of the blood that comes out, vaginal bleeding, will be differing depending upon which type of abruptio placentae. If it is a marginal abruptio placentae, typically vaginal hemorrhage is very much evident. There is an outlet for the hemorrhage to happen. But in the case of the moderate or high separation type of abruptio placentae, there is a block of that outlet by the fetus itself. Hence the bleed cannot come out and the fetus is in a grave danger because of the lack of the oxygen in this given situation. Then the third important type is external hemorrhage, probably will not be there in this. The third type is complete separation. It occurs whenever the fetus head is present in the cervical os and that prevents the external hemorrhage, and fetus also is in grave danger here. So here no more talking, immediate cesarean section need to be done in order to save the baby and the mother's life is what I want to underscore to all of you. So finally, doctor, in concealed hemorrhage, otherwise called abruptio placentae, what you need to remember is, if you do the abdominal examination, the height of the uterus is disproportionately enlarged. And the uterus is very tense and tender and it is very wooden in its feeling and in its consistency. Fetal parts cannot be detected because all that blood, which is as a thick layer, will prevent you from palpating, and fetal heart sound cannot be heard. They are all considered to be the cardinal features in the case of the abruptio placentae is what need to be remembered. Let's go to the next question. A lady with 12 weeks of pregnancy who is having a fasting glucose of 170, what is the antibiotic drug of choice? Already you are very sure it is the insulin. A 28-year-old female with a history of about 8 weeks of amenorrhea complains of the vaginal bleeding and lower abdominal pain. On ultrasound there is a gestational sac but the fetal parts are absent. Then what is your diagnosis? Is a very important question. There is an abortion here. But what type of abortion it is? Is it a threatened abortion, missed abortion, inevitable abortion, complete abortion? Let us be very sure about. If the cervical os is open, that is dilated, or it is not dilated, is a very important clue for you that differentiates different types of abortion. Threatened abortion. Here there is a vaginal bleeding which is painless and bleeding is fresh and scanty. But it is still called threatened. What is threatened about threatened abortion? Cervical os is closed. And on ultrasound, the uterus appears very bulky, well-formed gestational sac will be there and healthy fetal parts will be there. Os is still closed and there is a vaginal bleeding which is painless. That is the definition of the threatened abortion. One of the favorite questions of examiner, you have to be doubly sure about answering. You are going to check whether cervical os is dilated or is it closed. Based on that you will decide which type of abortion it is. If it is inevitable abortion, once more vaginal bleeding, but it is painful and there is a profuse fresh blood is there and cervix has become soft and cervical os is open and ultrasound will show the gestational sac low down in the uterine cavity. So already here the fetus is having the visa. It is no more ready to stick back. It is going to be aborted at any cost. It is inevitable is what need to be remembered. Incomplete. There is a history of expulsion of a fresh mass per vaginum is what typically the pregnant women will be complaining. Following that, there is a continuous pain per vaginum, typically in the case of the incomplete abortion. How will be the cervical os here? It will be pactulous, and already some contents of the uterus are already discharged. Hence the uterus will be smaller than what the period of amenorrhea is giving you. The idea is what I want to underscore to all of you. What is complete abortion? Here there is a variable period of amenorrhea followed by abdominal pain, bleeding per vaginum with the passage of the products followed by a decrease in the pain and bleeding is called complete abortion. Here also cervix is soft and the internal os is once more closed and the uterus is small and firm. So internal os is typically closed in the case of threatened abortion and complete abortion, but in the case of the threatened abortion, typically uterus is bulky and well formed and a well formed gestational sac, but in complete abortion typically it will be small because the fetus already has come out. The only problem is with the inevitable abortion and incomplete abortion, it is a patulous os in the case of the incomplete abortion and a open os in the case of the inevitable abortion is what you have to be doubly sure about.